Welcome to my channel. For those of you who've been keeping up, um, welcome back. Today, I know some of you are waiting for an update. I will be posting a separate video for um, for the update. There have been new developments, which I will discuss in a separate video. This one, however, was actually inspired by Mom herself. And I thought maybe I could help clear up some confusion. So I spoke with my mom the other day, um, and I'm talking to her about every other day. If there's a day that she's um, got a lot of people coming in to see her, I try not to add to the stress or the activity of too much talking. So I try to give her a break and space it out of consideration for the fact that she just simply um, can't breathe well. She doesn't have the capacity to hold long conversations, and it can be quite exhausting. So when I say a few days ago, I did speak with her. I've spoken with her a couple times since, but the question actually related to her being confused about the difference between hospice care and the long-term care facility. So I wanted to start by explaining those differences. I think I finally found the right words to help her out, and also discuss physical therapy for individuals with COPD. Um, so with COPD, um, chronic pulmonary chronic obstructive pulmonary disease. Yeah, it's hard to, you know, keep keep the letters straight. Um, so it is definitely a breathing disease. So with the long-term care, we'll start on this. Um, is essentially the kind of care that a loved one might receive at home if there's a family member that can be home. Um, Traditionally, historically, we've referred to nursing homes for people who are elderly, can no longer um, care for themselves, need the extra attention, have serious medical conditions. Maybe they've suffered a stroke or have been severely injured with multiple types of injuries from a car accident. Uh, but essentially, it's for, long term, more than a week or two. It's not a hospital stay where one might expect to be there for a couple of weeks to recover from surgery, longer if in ICU. But nursing care or long-term care involves a skilled staff, similar to a hospital, where they may have a physician on staff. They will have licensed nurses, either LPNs or RNs or both, registered nurses, licensed practical nurses. They will also have certified nursing assistants or CNA, nurses' aides, as well as physical therapists, and in the case of where my mom is, they even have an on-site pharmacy. So the purpose of the long-term care facility as opposed to hospice can seem a little muddled. In my mom's case, she was confused. She thought they weren't necessarily on the same page, that they may even be at cross purposes. She didn't quite get why she needed both and what one has to do with the other. So I understand why that can be confusing. As I've explained, the long-term care has more to do with the day-to-day living. They will change your linens, they will make sure you eat, they're responsible for, in the case of an incapacitated person, possibly IVs, they'll treat bed sores, um, help with bathing, administer medication. They will, depending on the type of care needed and what one qualifies for, uh, they may provide physical therapy. Um, they may help you get dressed, get down to the dining room for breakfast, or um, in other cases, have the food brought to you you can so that you can eat. In my mom's case, they actually do monitor her food intake. They keep track of the oxygen levels and adjust them as necessary. Again, they're skilled, licensed um, professionals. So they will help with um, her breathing treatments. They can get get the person into a wheelchair, help them get outside to get some fresh air. They will uh, help get um, medical treatments as necessary, qualified, and appropriate. In my mom's case, because she is in hospice, there are no new treatments. There will be no medical intervention. So, moving on to what hospice does is they really are comfort only. It's comfort care for um, end of life transition, typically for people who have a life expectancy that's very short. They told me 6 months or less is what typically qualifies a person for hospice care. So, what hospice does, as I said, was comfort care only. They will provide medication for, in her case, ease of breathing. In other cases, it could be for pain relief. Um, they provide the oxygen. They provide comfort therapies like massage, um, as well as some um, daily care. Like they will, um, similar to the nursing care, they will also assist with bathing, personal care, hygiene, that sort of thing. But their purpose is to provide spiritual and physical comfort and consolation, maybe. But the idea is that there's no medical intervention. So if a person in hospice care develops a new condition, let's say, for example, my mom with COPD, if she was to, if they were to discover, let's say she has cancer, they're not going to treat the cancer. They're going to provide, um, continue to provide comfort care, pain relief, um, and personal care assistance. They even, in some cases, will have a chaplain come by to provide spiritual direction. In my mom's case, she has a minister that she has a personal friendship with for several years. He and his wife have been, um, good friends. They ran the church my mom attended for years. And so there's that spiritual connection she has there as well. So that's kind of the difference between hospice and long-term care is comfort versus medical intervention or day-to-day living assistance when that assistance is needed more than assisted living, where somebody can come in, once or twice a day to assist with maybe cooking meals, do some light cleaning, um, and with personal care. But it's when you need more than that. Um, and often long term care is needed when there is no one at home that's physically capable of assisting the person with those things. My mom, for instance, lived alone. I've offered to have her come move in with me, which we'll discuss more in the updates. But she has finally figured out that she cannot live alone. Whether she stays in long term care or decides to do something else, she cannot live alone. And that's typically when long term care is needed. Um, Sometimes it's somebody who's completely incapacitated and loved ones at home have to work. They've got to pay for the home. There might be children who need taken care of. And, somebody still has to pay the rent or the mortgage. Somebody still has to buy the groceries. Somebody still has to buy clothes and pay for school supplies. Um, and so people have to work. And it's not like the old days where there was typically one or more family members that could be home and provide full-time care for the aging person or or the ill person. It's just not that world anymore. Um, in my case, I live almost 1,000 miles away, so I can't just hop in my car after work and go check on mom, which I would be nice if that was an option. But for a lot of people across the country, it really isn't. Some people have more than one person who needs care. It could be both parents. I have a friend um, who has two parents that she um, has to assist. And each parent does live alone. One is more in an assisted living facility, the other parent is in her own home. And it can be challenging. Plus, there's, one's own family. In my case, I still have to pay for my house. Um, I'm fortunate in that my child is now an adult and capable of assisting rather than needing assistance. So that's fortunate for us. In a lot of families, that's not the case. As I said, sometimes there's still children at home. So the purpose of long-term care facility or the proverbial nursing home really is to provide that immediate, long-term, everyday care that's necessary. So, can they be at odds? Well, one will provide medical treatment as appropriate, the other will not. And that's actually okay. It's not necessarily a contradiction because a hospice patient in long term care is not going to get intervention, as I said, for cancer if they're in for having had a stroke, or they're not going to get intervention for uh, a heart attack if they have COPD. Hospice does not interfere with the natural progression of the illness. And in a lot of cases, that's really a good thing because some people just fight and fight and fight to such extreme financial cost and physical, uh, such a physical toll on the body that it just is heartbreaking, absolutely heartbreaking. So, where does physical therapy come in? Well, long term care is likely to offer physical therapy to patients that have a likelihood of recovery. So, somebody comes in with broken bones or recovering from a stroke, they will more than likely get the physical therapy to help regain their their physical functionality, to be able to walk again or be able to do for themselves in a way that maybe they can't at the present moment, but have a likelihood of needing to and of being able to. So it's for people who can recover. They're not likely to do much physical therapy for someone who's in an extreme decline. So if, for instance, the COPD, if they thought there was a chance of recovery or graduating out of hospice, which can happen. Um, I've heard a lot of stories, um, and you'll definitely want to talk to your personal um, medical professionals for, what your own prognosis is. Um, but physical therapy for a hospice patient isn't really likely. And the reason for that is if you're strong enough and healthy enough to do physical therapy, you probably don't need hospice. If you're on hospice or in hospice, you probably aren't strong enough and healthy enough to handle physical therapy. So, in my mom's case, her nurse has suggested, because mom is pushing for physical therapy that she just simply can't handle. They have indicated that they can get her up and take short walks, get her walking a little bit. And that's really what she wants anyway. I mean, she's not going to get in there and lift weights and get on a treadmill or even let them do the chest compressions or other types of therapy that um, some facilities and some providers will offer. So, physical therapy, again, in the conventional sense, isn't really an option, at least not for my mom. Again, if anyone is facing this, you'll want to talk to your own medical people, your doctors, your nurses, um, the hospice team. Um, but essentially, that's the difference. Physical therapy is to aid recovery. Long-term care is to assist with day-to-day tasks of living and functioning, and hospice really is there for comfort and uh, and to ease end of life suffering. And some people struggle with that end of life thing more than others. It's interesting that one would opt for hospice, but yet keep keep fighting and want measures to improve one's condition, when the purpose of hospice is actually the opposite of that. It is to not have medical intervention. It is to not have life-saving measures. It's comfort care, as I have repeatedly said over and over and over again, redundantly, repetitiously. How else can I say it? So that's the difference. And so the purpose of today, of this video, really was to kind of lend clarification. If you have additional questions or want to discuss this, please comment. Um, if you found my video helpful, please like. Um, feel free to subscribe, but no obligations, just it's an option if you want to. But definitely we can have a conversation and discuss the differences. There's other types of care and treatment for different stages um, of illness and terminal illness, which I should have mentioned earlier, in regards to hospice, usually implies terminal. So again, Thank you. I will see you in the update, and hopefully we can connect. And yeah, so have a blessed evening, and I will see you soon.